I'd like to now request the Chairman of Perumal Enterprises, Mr. Ajay Perumal, to please tell us why it is compelling for such a collaborative initiative to be taken and his involvement in it.
The Honorable Minister for Tribal Affairs, Shri Arjun G. Munda, the Honorable Minister for Health and Family Welfare, Mr. Dr. Harshvardhan, our Secretary for the Ministry of Tribal Affairs, Dr. Subramaniam, our partner in this collaborative, Mr. Hari Menon from the Bill and Melinda Gates Foundation, and all of you who are so interested in tribal health. We've heard a lot of really good knowledge and data this afternoon, but I thought I will begin with a story. I'm going to give an episode which took place, which is in the Ramayana. When Lord Ram was banished from Ayodhya and had to go for 14 years into the forest, the first thing that he asked his charioteer Sumantra was that I want to go to my friend Nishad Raj Guha's kingdom. Nishad Raj was a tribal. And at that time, when they saw each other, near about each other, when they reached the kingdom, Nishad and Ram actually ran towards each other, hugged each other, and there were tears of joy from Ram's face because he saw his good friend, and from Nishad there was tears of joy, and also he was sorrowful that why is my king going to come here and into the forest. Nishad offered his kingdom, his people, his army to Ram that you rule, I will be under you. But Ram said no and said that there is no other friend like you in the world. So why am I giving you this story? Just saying that our culture talks about a very close relationship between people who are more privileged and people who live in the tribals living in the forest. But that was probably in the days of Ram Raj. Now I want to come to today's world. I'm going to relate to you the story of this young 15-year-old girl who was married in a tribal district called Araku in Andhra Pradesh. That is a district where our foundation has been working for more than 10-12 years. And I want to just relate the story of what happened with Sujata. This young girl, as I was pregnant at the age of 15. I'm sure some of you may know Araku, but Araku is such a remote tribal village that even to reach it, you first have to go by car to a certain distance. Then from there you have to go by a two-wheeler because there's no road. And to reach the last habitation, you have to walk maybe 5-7 kilometers. So here was Sujata. She could only get 2 antenatal visits. And then she had a premature delivery. Her baby was 2.1 kgs when born, and he did not survive. So this is in some ways the story of many of our tribal areas. But there is also the other side. After working for several years in Araku, we found that in the last 3 years, with the use of technology, with the use of all the other facilities available, there has been not a single maternal mortality death. So, that gave us inspiration that if it can happen in Araku, if it can happen in the aspirational districts, which actually Dr. Paul spoke about where we were, it can happen anywhere in the country. We have a population of 100 million plus tribals all over the country, 9% of India's population. But if you look at the statistics, it is quite grim. 45% of children in these areas, tribal areas, are underweight. 44% of them are stunted. 31% of women in these areas are undernourished, and 58% of the women who are pregnant are anemic. So these are stark figures. I think the Prime Minister recognized that if we have to satisfy, if we have to come anywhere near the SDG goals for 2030, if we don't work in the aspirational districts, if we don't work in the tribal areas, we will never reach those numbers. And that is the basis for us meeting today. Our foundation has always believed that the role of foundations, of private enterprises, is to do innovation. The government system, by its very nature, cannot allow too much of innovation, because innovation means risk. Risk means that some things are going to fail. And with so many other, the 3 C's as they call them, whether it's the CHE, whether it's the CBI, and I forgot the third C. It's very difficult to make mistakes. This is what is the role that we can do. Besides that, so we believe that we should do innovation. We believe that we should do innovation on scale. If you do it in 1,000 people, in 1 billion people, makes no difference. You can't move the government. So I'm sure, Dr. Subramaniam, you will only recognize if you do things on scale. We also believe that you have to have people, you have to collaborate and partner with government, because no other in India, if you have to solve problems, unless you partner with government, and you cannot succeed. Partner with organizations like the Gates Foundation, the SIF, USAID, and all of you over here, you cannot succeed. And you have to partner with the community. I think Dr. Paul also mentioned that quite a few times. And that's what we are trying to do in this healthcare initiative, the Tribal Healthcare Initiative. The name, Anamay, there is a meaning behind it. It means disease-free, it means trouble-free. And therefore this health cooperative is that will make us, hopefully in this journey of making tribals more health-free, more disease-free, and more trouble-free. I just want to thank the Ministry of Tribal Affairs. They have taken a lot of initiative in this. It would not have happened without them. So I want to thank them. I want to thank all the others of you who have come here. And there have been so many other NGOs, partners who want to come with us. Rockefeller, Ekjut, the Wish Foundation, SIF, and of course, the Bill and Melinda Gates Foundation, and many other NGOs who are together. I think I would also like to thank personally Mr. Arjun Munda for his interest, Mr. Harshvardhan, Dr. Harshvardhan, and even Minister for Women and Child Development, Madam Smriti Irani, because she could not come because of her commitments in Bengal, but she spoke to me and has sent a message, so I just want to communicate my thanks to her. Niti Aayog has always been a partner with us in the aspirational districts and here too, so I would like to thank them. And I also want to thank the press to come here, the media. It's such an important It's such an important initiative for nation building, and that you all are supporting it is a big thank you. Thank you.
Thank you very much, Mr. Piramal. I'd like to now invite the Senior Vice President, Piramal Swasthya, Dr. Shailendra Hegde, to tell us more about Anamay, the proposed Tribal Health Collaborative.
Respected dignitaries and distinguished guests, it is my privilege to stand before you this evening and share about Anamay, a multi-stakeholder collaborative committed to improving health and well-being of the tribal people of India. Initially, Anamay will focus on 20 million tribal people across 50 districts of India through 3 core functions. It will first focus on facilitating the delivery of comprehensive primary health care delivery in the areas of maternal and child health and nutrition, tuberculosis and communicable diseases, and non-communicable diseases. In areas where issues such as sickle cell disease, snake bites, and other diseases are common, Anamay will also focus on them. The second important function is one of the unique features of Anamay itself, which is focusing on developing and disseminating knowledge as well as generating evidence from the work that we will do. This evidence-based approach will facilitate cross-learnings from informed policies and thereby further help scale the impact. We've been talking about the push in the digital sector, and the third most important function is the technology backbone for the entire collaborative. The technology backbone will ensure that we improve the governance, accountability, and decision-making for the tribal people of the country. Anamay is being mentored by renowned experts and thought leaders in the field of tribal health and nutrition, including Dr. Soumya Swaminathan, Dr. Abhay Bang, and Dr. R. Balasubramaniam. Partnering with the government, as Mr. Piramal already mentioned, is of utmost importance. But equally important is also partnering with the community. Dr. V.K. Paul mentioned about the demand generation side of things. The collaborative will focus on both demand and supply. So demand generation with engagement with the tribal communities is of utmost importance and will be one of the core pillars of the functioning of the Tribal Health Collaborative. Anamay brings together core partners to ensure good governance and strategy creation. It brings together implementing partners who can give us the learnings of decades of work that they have done in the field, knowledge and research partners who can bring in evidences to be able to share the learnings, and last but not least, monitoring and evaluation partners who will help us track the journey and also correct course. Partners will work together towards achieving Anamay's vision to end preventable deaths among 104 million tribal people of the country. Thank you very much.
Thank you very much, Dr. Hegde. As was mentioned, Anamay, the Tribal Health Collaborative, aims to build a high-performing, sustainable health ecosystem to address the needs of marginalized sections of society, particularly tribal communities, covering a population of more than 150 million across several districts, including aspirational districts in central, eastern, and northeastern India. This compendium that we are hoping to launch now of district-level tribal health fact sheets is one such strong step towards generating nuanced evidence that can function as an authentic baseline of the state of tribal health and nutrition. Piramal Swasthya Management and Research Institute, in partnership with the International Institute for Population Sciences, Mumbai, created these fact sheets using the data collated through the NFHS4, the 4th edition of the NFHS series conducted in 2015-16 by IIPS. It has systematically coded, organized and calculated the available tribal household raw data collated, and it presents a total of 95 indicators spread across 12 categories, including that of population and household profile, marriage and fertility, maternal and child health, nutritional status among adults, anemia among children and adults, among others. A collection of 241 fact sheets that provides health and nutrition information for the ST population of 500 Indian districts. The document also plays a crucial role in designing and initiating evidence-based health issues and policies, strategies and public health actions suited to the unique social, cultural and geographic environment of tribal communities. I'd like to request Mr. Aditya Nataraj to please come up on stage and join our dignitaries here, as I request Mr. Piramal and the honourable ministers who are joining us online, who are actually there online, as well as Dr. Shailendra Hegde, Dr. Subramaniam and Mr. Hari Menon to please launch this Tribal Health Compendium. May I request the Joint Secretary, Mr. Navajit Kapoor, to also join us.
Well,